Tkellimna fuq ħafna affarijiet, we spoke about a lot of things. I know that Dave wanted to speak about the pandemic treaty, not to live in the past, but not to forget what we've been through, and let's look forward to a more brighter future.
I think just to cover as Dr. Tess was saying earlier, the WHO were very adamant and people needed to take this seriously, and the government here in Malta did declare a public health emergency. They declared it on the 1st of April, which might be ironic, but they dated it back to the 7th of March to show they were taking this seriously. On the 30th of June, they withdrew the declaration. It was no longer considered a public health emergency. But I know that 30 June of 2020, measures didn't change. Nothing changed in my life, nothing changed in my business, and it carried on, even though we no longer had officially a public health emergency. It makes you wonder why so many things were happening if the government had determined there was no longer an emergency. So it raises a question.
It actually got worse.
Yep.
The measures got a lot worse if we go through the cycle of the public health. So in that summer of 2020, that was, a bit of a summer, but it was, beyond that is where they started bringing in all these social distancings, which we now know is completely false. They brought in all of this mask wearing, they brought in tons of various different requirements, and they made it impossible. I know many businesses who had to shut down through this. So it was the measures they brought in after the emergency was over in Malta that made life unbearable, really. And there was nobody who would listen to you. I can tell, in the restaurant space, ACE and MHRA did not help. Actually, in ACE's case, in October of 2021, 87% of their respondents said that COVID vaccines, making them mandatory and forcing staff to vaccinate, 87% responded to say no. Where was ACE through this?
Yes, but we only knew 4 years after that it did not work out. So the decisions taken are based on what?
Well, I think we knew as we were going along because there was so much reporting. There was, to the day, they were reporting cases, they were reporting tests. There was so much data collected that I think we do know, because if you looked at the point Dr. Susan Vossler was saying, 95% of those who sadly were attributed to COVID when they passed were over the age of 55. This was not a risk for the younger person or for the healthy person. And so I think very soon, very early on, we actually understood that. And it was the risk profile that was just ignored. And that's something that the medical professionals, the pharmaceutical industries, we always had to look at risk profiles. There is a risk-benefit analysis, and it seemed to just be forgotten for the last number of years.
But that is why there are programs like these and people out there who are willing to help, and that is why now we call up on you, televiewers, anybody would like to help, any professionals may be following us at the moment, doctors who would like to sign the North Letter, and that is why earlier I said that I'm involved, because I felt the responsibility to sign the North Letter, because I believe that the mRNA vaccines should be taken out of the market until we are absolutely sure that they are safe.
Absolutely.
Yeah, I think that the choice of the individual should be the primary focus in future, and that people should be given the information to make informed decisions.
Yes.
Your program's been really good in making awareness, and everybody should take on board different opinions, but then make conclusions based on their own thoughts.
Exactly.
Interestingly, there is a patient charter contained within the Department of Health website. You can download it. It's only about 12, I think, pages, 13 pages.
The patient charter.
Patient charter. If you search for that, it was released by Dr. Fern a number of years ago, and it clearly articulates your rights to information, your rights to receive this information, to be able to consult with your family and the like, your right to refuse the treatment, your right to ask for a second opinion. These things are all clearly stated in the charter released by the Department of Health. People that we talk to, sadly, seem very unaware. If they're told, no, you can't bring someone to a consultation, they believe that that's the case, and that is not the case. People should be asking questions. I'm the son of 2 teachers. I grew up asking why to literally every movement my parents made. I would be asking why. Somehow we stopped asking that question as we grew up. Somehow we stopped having that wonderful, naive questioning, and I think it's to our detriment. So
questioning is being creative. Questioning is the growing ability to criticize in a very good manner, in a constructive manner, and that is what we need.
It's growth.
We do not need yes sir people.
It's growth. It's growth.
Yes.